And I think, I'm sorry, I'm not very well organized. What I need to say before I close is a couple of words about the project for which we were honored. As Kendall mentioned, cooperative is composed of Muslims, Christians, and Jewish coffee workers all working together in peace, which we thought was an extraordinary world model. And so did the people at Tufts University. And so did over 100 people 3 weeks ago who attended a community building and fundraising dinner for visitors from the cooperative who finished up a second national tour, U.S. national tour, here in Fort Bragg and visited here. We had a Jewish coffee grower, an Anglican coffee grower, a Catholic, and a Muslim have dinner with a sold-out crowd at the Casper Community Center. And it was a heartful, inspiring, educational evening. So thank you all again, and remember, it is fair trade, not free trade, that is the key to the future. Thank you very much.
Thank you. Mr. Chairman, I don't believe we had the motion yet on this proclamation, but before I make that, I would like to just thank the CATSFs for their community service. They're always available to community groups. They do lots and lots of donations for nonprofits to make sure events go forward and people feel welcome, and I really want to appreciate them for that, as well as their own adherence to very high environmental standards. In the years that they've been here, which is over 30, they've continually evolved their business practices and made them more and more environmentally sound as time has marched on, and we've been all made aware of environmental situations that we can, if we pay attention to, we can change and improve on, and they're always willing to do that, and they're always trying to go to the farthest edge of making their business as environmentally in the moment as you possibly can. They're always doing that, and they're always there to support the community. So I want to thank them and thank them for their efforts both locally and internationally. And I make the motion for the adoption of the proclamation.
And that is a motion. Do I hear a second?
Second.
It's been seconded. All those in favor say aye.
Aye.
I also would concur. This is an amazing county we have, and it involves a tremendous amount of outstanding individuals and outstanding companies, and that's what makes Mendocino County great. And as I stated half an hour ago, this is one of the fun things this board gets to do, is to recognize those people in this county, and it's tremendous for us to do that. So thank you very much. There is a motion and a second. And did we vote? I'm having a senior moment here, sorry. Okay, all those in favor say aye.
Aye.
All those opposed? Okay, passes unanimously. Being forgetful, it's kind of wonderful. It makes everything new and fresh. So. Item 9D, a discussion of possible action including adoption of proclamation declaring April 7th through the 13th, 2008 as Public Health Week in Mendocino County. Supervisor Dober, would you present this item, please?
Sure, Mr. Chairman, thank you. I have before me the proclamation of the Mendocino County Board of Supervisors recognizing National Public Health Week, April 7th through the 13th, 2008 in Mendocino County. Whereas each year, in conjunction with the American Public Health Association, the Health and Human Services Agency Public Health Branch celebrates the first full week of April as Public Health Week. And whereas the theme of National Public Health Week 2008 is Climate Change, Our Health in the Balance. And whereas climate change is an urgent public health issue, and whereas only a small percentage of Americans have plans to respond to climate change, with most Americans largely unaware of the connection between the way we lead our lives, the impact on the planet, and the planet's impact on our health. And whereas most Americans, including the public health workforce, remain largely unprepared to face the public health challenges associated with climate change. And whereas climate change may cause extreme weather events and changes in environmental conditions, leading to increases in disease and death. And whereas the nation's most vulnerable populations, including young children, the elderly, people with chronic illnesses, and people in underserved communities, are most likely to be disproportionately impacted, yet least able to prepare, respond, and recover from the health effects of climate change. And whereas local, state, and federal governments, along with numerous other organizations, must increase their efforts to educate Americans and the public health workforce about what they need to do to mitigate and adapt to the consequences. And whereas all communities must plan in advance to ensure their public health agencies and residents are prepared for and can respond to the health consequences of climate change. And whereas Mendocino County government is making efforts for a greener environment through the purchase of hybrid vehicles, drafting a proposal related to the ban on plastic bags, and using the precautionary principle that provides overarching guidance for the county and its individual departments to maintain and develop policies and regulations for a healthier Mendocino County. Now therefore be it resolved that the Board of Supervisors of the County of Mendocino hereby proclaims April 7th through the 13th, 2008 as Public Health Week and recommend this observance to all of our citizens. Dated April 8th, 2008, Jim Wattenberger, Chair.
Thank you, Supervisor. And accepting this proclamation will be Carmel Angelo and Stacy Cryer, and then comments from Phyllis Webb. So that is a motion, Supervisor? Do I hear a second?
Second.
It's been moved and seconded. All those in favor? Aye. I'll suck it in
I'm Carmel Angelo, Director for the Health and Human Services Agency. Again, thank you very much for the proclamation, for recognizing Public Health Week, and all the good work that's done in public health services in this county by County Public Health and by also our community partners. In the interest of time, I would like to introduce Phyllis Webb, our public health analyst, who will share with you just some key highlights from the Mendocino County 2008 Community Health Statistics Report. Thank you again.
Thank you, Carmel.
Hi. You all know I can go on and on about this data for quite a long time, but I'm going to make it very short. You've already received your copy. I'm pretty sure everyone has one. And we've also passed around an additional little packet. There are also a few copies of the report on the back table, as well as the executive summary and a PowerPoint presentation that kind of walks you through the report. And this report is available on the public health website, so if you want to get your own copy, please do so, or call us at the health department. So the things that we've given you in your packet are a PowerPoint presentation that I've done, and the executive summary, which, kind of gives you an overview of the report, and the schedule of events for Public Health Week. So we didn't have all that together when you got your report, but we do now. And I want to thank you for the past, this is our 7th report. We've been doing this since 1996, and we've always had a tremendous amount of support for this report from the board, and we have appreciated that over the years. This report has actually become a tool for county decision makers like yourself, program planners, stakeholders, grant writers, students and consultants, and others. And what the report is really aimed at doing is to begin a dialogue about information. Oftentimes, you'll see broad statistics in this report. They're population-based statistics, and they often, I've noticed over the years, ask more questions than they actually answer, which is an interesting thing for a report to do or any information to do, because it means if you really want to get to the bottom of it, you got to dig a little deeper. And that's what's happened over the years. People get interested, they call, we get some more statistics that are broken down by region or